Dr. Dan Yachter here of Elevation Health. I'm here with our pregnant patient, Sarah, and we have just some great information we're going to share with you, not only in this segment, but future segments to come. A couple of considerations for pregnant women. Let's just talk about the nutritional ones briefly, and we'll come back to these again in future segments. What's absolutely crucial to start with nutritionally with a woman is the right amount of hydration while a woman's pregnant, and minerals. Those are two crucial considerations. Again, we'll talk more about that as we go on with segments. Omega oils, fish oils, B vitamins, especially folic acid, B9, B12, for the proper development of the embryo and fetus. Absolutely crucial, especially B9, neural tube defects, whatnot. And of course, vitamin D, K2. These are important considerations, the foundation of nutrition for a pregnant woman, the right amount of hydration and minerals throughout the day. Okay, so that's the first consideration. Nutritionally, two things to avoid. Preeclampsia, high blood pressure, gestational diabetes, things of that nature. Watching out for the amount of sugar that comes in, watching out for fried foods, things that elevate the blood pressure. And then of course, one of the things you gotta watch out for, one of the myths of pregnancy is eating for two. In fact, this is a known medical fact that the caloric intake really does not have to go up significantly. We're looking at 300, 400, maybe 500 additional calories. It really doesn't require much more, and a woman's really got to be careful with the amount of weight that they put on, the amount of unnecessary weight that they put on. So another consideration, exercise. The best way to keep the body fluid, the biomechanics of the body fluid, the best exercise, swimming, a non-gravitational type of environment. It really helps keep those biomechanics moving properly. We're going to talk about the pelvis here. We're going to start today, kind of introduce you to some of the ways we care for pregnant women. The Webster technique is one of the things that we use in the office. But one of the things that could happen as the baby's developing is the pelvis and the sacrum, this pyramidal bone down here, triangular bone, can move out of alignment, can rotate. And as it rotates, as it misaligns, it can irritate, inflame, damage, weaken nerves. The inflammatory effect that it has on the nerves can cause a lot of pain, sciatica. As you're seeing over here, there's a chart on the wall. When these pelvic bones shift and irritate the nerves, or inflame the nerves, damage the nerves, interfere with the messages coming down, we call that subluxation. Subluxation of the pelvis can cause a lot of problems. In a pregnant woman especially, it can cause pain. It could actually cause muscle spasms, which restrict the pelvis. And these nerves also go into organs, into the uterus, to actually control the development, growth and development of the baby as well. Also, if the pelvis and the biomechanics are not moving properly, there may not be enough room for the baby to develop and grow. And of course, when the mother goes to give birth, if the biomechanics are not healthy, it could actually create a problem with the pelvic expansion and the delivery of the baby as well. So we're going to go ahead and show you. Again, just to start off with, I simply want to show how a pregnant woman can set up for an adjustment, how we make it very comfortable, very easy. But I wanted to show you kind of what it looks like, because most people are unfamiliar with, most women who are pregnant wondering about this type of care are unfamiliar with the setup. So Sarah is going to go ahead and we have these pillows here. They actually have a concavity in them, so the belly very gently and comfortably sinks in to here. So depending upon how far along we are in the pregnancy, if it's the first trimester or so, we use one pillow, second, third. Typically we bolster it up a little bit, and as you can tell, we are far enough along to use two cushions. So I'm going to have Sarah go ahead and set up. I simply want to show you the setup on this video, and then on future videos we'll be getting into how we actually adjust the pelvis. So fantastic. A lot of women are saying, wow, I would love to be able to lay on my stomach while I'm pregnant. So this is what it looks like. And then we proceed with the adjustment. On the next segment, I'm going to show you actually how we address the pelvis, the sacrum, how we perform the Webster technique, which is a technique that frees the pelvis up, removes the nerve interference, so the woman can have an enjoyable pregnancy. So that's it right there. That's the segment. I just simply wanted to start off by showing you how we begin the adjustment. This is one way of adjusting, but when we do the Webster technique, this is how we begin the process. So Sarah, thank you, and there'll be more to come. Just wanted to introduce you to pregnancy and chiropractic care. Dr. Dan Yachter signing off for Elevation Health. God bless.